As we all know, the first lockdown of the COVID-19 pandemic began in spring 2020, and I don't think any of us were really prepared for the shifts in our lives and working practices that resulted. The pandemic has had detrimental economic impacts, and with the end of furlough and uplift to the universal credit payment in sight, we unfortunately expect this to go worse. It's also exacerbated social inequalities in society, with the Health Foundation stating that the virus will have taken an uneven toll on an already unequal society. The gap between rich and poor has widened, and certain groups have been disproportionately affected, such as people from Black, Asian and minority ethnic groups, and people with disabilities and their carers. As an organisation, we adapted quite quickly to the first lockdown and changed the way in which we delivered some of our services. A year later, we wanted to carry out some research to understand what had gone well, where we could improve, and what was next on the horizon as we come out of the peak of one crisis but are likely to enter into economic, health and societal crises. We know that people living in poverty are the poverty experts, so we set up conversations with people who'd used our services over this period of time in order to listen, learn and adapt from what they told us. Some of our services online during the pandemic, including This Way Up, a project aiming to increase people's resilience. Andy explains what it is.
Way Up was a course that I've just finished. It was a course of 6 mindfulness lessons, and in parallel with that there were 3 life coaching courses. I've had sort of therapy in the past, but the life coaching was a bit different, and mindfulness is something completely new to me, so I found it quite good.
This Way Up used Zoom for the group sessions and phone or video conferencing for the one-to-one sessions. They found that they had the same outcomes whether they delivered online or face-to-face, but they also had higher attendance with the online sessions. Amina explains how the project helped her.
Main change for me has been being aware of what I'm eating, what I'm doing, what I'm thinking, and it's the awareness, and because of the awareness it's impacted on my mental health and my physical health as well.
In conversation with some of the This Way Up participants, we were told that moving online removes some of the barriers that would otherwise have stopped them attending or participating fully, such as social anxiety and travel. That meant that we were able to reach more people and a wider range of people than just within our East London base. It meant that people were able to improve their resilience at much needed time. We also delivered Up to Speed online during the pandemic, which was a project designed to equip people with digital skills to help them become more financially resilient, such as helping them understand how to use internet banking. In conversation with some people who attended that course, we find that actually it's quite hard to learn digital skills remotely when your confidence of getting online is quite low. So using that knowledge, we're now running a similar service, but with face-to-face sessions, so helping people improve their financial resilience and digital skills together with some COVID precautions in place. We know that some people don't have the money for an appropriate device or access to the internet, so we're also supplying some devices and data packages as part of this service. So we learned that digital can really be an opportunity as well as a barrier. Moving services online has certainly made things more accessible for some people, but it also made things less accessible for other people. And so we're really now reflecting on where it's best to deliver online and where it's best to deliver face-to-face. We're thinking about other barriers to accessing our services too, and this will be part of our broader equity, diversity and inclusion work. Other things on our mind for the future include having our internal projects work closer together, looking at where we can create partnerships with external organisations to share our work and increase our impact, how we can make best use of volunteers, and keeping an eye on staff wellbeing as we come out of the pandemic, which has been a collective period of trauma.